Hello and welcome to Back to Health. This is a show dedicated to providing health information and education to the Bella Vista community. My name is Dr. Philip Corbin. I have a bachelor's degree from the University of Arkansas in exercise physiology and am an American College of Sports Medicine certified health fitness instructor and cardiac rehab specialist, and have a Doctor of Chiropractic degree from Palmer College of Chiropractic. For the last 15 years, I have practiced management of health conditions through rehabilitative exercise, chiropractic, massage therapy, and ways to manage things that are drug-free and side effect-free. Today we're going to talk about a very common condition that we see in our office, and that is degenerative disc and degenerative joint disease. Low back pain is one of the most common things that is in our society today. It is estimated that in any given 3-month period of time, a quarter of the entire U.S. population deals with at least one day of back pain. One of the most common and primary reasons for this is degenerative disc and degenerative joint disease, and that's what we'll be talking about today. When we talk about degenerative disc disease, we're talking about the disc inside of between the vertebrae. These act as shock absorbers on the anterior portion of the vertebral bodies here. As the body loads and unloads, these are fluid-filled sacs that absorb like little shock absorbers and allow for more freedom of movement. Real important to this complex is what is called the intervertebral foramen, where you have a nerve root exiting throughout the entire body. These are the nerves that supply all the body to allow it to have feeling and movement and all these other aspects of our living. If we take a more close specific look, this is my remedial explanation of what a degenerative disc would look like. You're going to get compression. This area in here would demonstrate what is called a vacuum phenomena, being that the fluid inside of the disc actually dries out and it leaves an opening. You'll get degenerative changes. You'll get spurring off of the anterior bodies. This will become smaller. And over time, what happens is your body will basically shut this joint down and create one instead of two parts. Traditional medical community looked online and was looking at WebMD, which is the most searched web health information site, and they would define degenerative disc disease as not really a disease but a term used to describe the normal changes in your spinal disc as you age. They're soft, compressible, separate the interlocking bones like we were just discussing. It may result in back or neck pain, but it varies from person to person. People can have the same situation, one experiencing no pain and one experiencing significant pain. And the last statement in this was that pain may start after a major injury such as an accident. A minor injury such as a fall from a low height or slipping on ice would be a good example from recent history here. Normal motion such as bending over to pick something up, and it may also start gradually for no known reason and get worse over time. But in some cases you may also have numbness or tingling down your legs and arms. However, in all of these explanations, they're not in any way describing mechanism of injury, and I think that is critical to understanding what degenerative disc disease is. It is not a normal, fundamental progression of aging. Yes, gravity is a constant. Yes, gravity plays an ultimate effect on us, but prevailing literature states that all joint and joint processes in our body, the way to manage them is through movement. The absolute worst thing you can do to any joint in your body is to freeze it and keep it from moving, because it will in a very rapid period of time degenerate to a point that it will need some sort of correction. Many people have had casts and that kind of thing, and it doesn't take very long at all for that cast to come off and all of a sudden your body looks significantly different. Today's guest is Miss Bridget Van Houten. Thank you.
Hi, Doctor.
Bridget, I'd like you to just tell us a little bit about yourself.
Well, we've been here in the village for about 16 years. I have experienced low back pain for many years of my life, and this last winter the pain was located in each of my hips and was very difficult to walk, and could not even get around. And so I have been diagnosed with osteoporosis, degenerative disc, and certainly diabetes. And all those things compiled together brought me to Dr. Corbin.
Okay. Well, that's not good, is it?
No, it
Okay.
has
Well,
not
tell me a
been
little
good.
bit about what you went through to get to those diagnoses and the different things that you had to experience before we met.
And well, I went to different doctors.
Your primary care?
My primary care physician, and he would give me muscle relaxant pills and pain pills, and he referred me to an orthopedic specialist, and they x-rayed me and found there's nothing wrong with my bone structure, you know, and but I just wasn't getting any relief, and I just thought that it was necessary that we do something that could make me more productive and functional.
Now, I know there was a big experience in the winter that was really a big thing that you had to experience before we met, and that was you had to go to the hospital, right?
Yes, I was having such difficulty walking and just getting around in my house, and I just couldn't stand any period of time, and so we went to the well, it was late at night because I was in so much pain this one night, and went to the emergency room, and there just wasn't a lot that they could do for me.
Well, that absolutely. And we're glad you made it to our office. Bridget was basically describing a very typical pattern of what we see, and that is what the standard medical model how they address these things.